Don't watch this if you don't want to memorize pharmacology drugs easily. This is great for NPs who plan on taking the NP board exam. Step 1. This step gives you the foundation for the rest of the process. Here are some key drug classes to focus on. Antidepressants, for treating depression, anxiety, and mood disorders. Antipsychotics, for schizophrenia and bipolar disorder treatment. Anxiolytics, for managing anxiety and helping with sleep. Stimulants, for ADHD and narcolepsy treatment. Opioids, for pain management. Antihypertensives, for managing high blood pressure. Anti-diabetic agents, for managing diabetes. Cardiovascular drugs, for treating heart conditions like heart failure and arrhythmias. Gastrointestinal drugs, for treating digestive problems like acid reflux and ulcers. Respiratory drugs, for treating respiratory conditions like asthma and COPD. Remember to gain a solid foundation in how medications work, their therapeutic uses, and potential side effects. Second step. Now that you know the major classes, breaking them down into smaller categories gives you depth and structure for understanding pharmacology. Let's start with antidepressants. We have selective serotonin reuptake inhibitors, also known as SSRIs, like fluoxetine, Prozac, atypical antidepressants, like bupropion, Wellbutrin, and tricyclic antidepressants, also known as TCAs, like amitriptyline, Elavil. Next, for cardiovascular drugs, we have beta blockers, like atenolol, tenormine, ACE inhibitors, like lisinopril, Prinavil, and calcium channel blockers, like amlodipine, Norvasc. Moving on to antidiabetics, we break it down into sulfonylureas, like glyburide, diabeta, biguanades, like metformin, glucophage, and thiazolidinediones, also known as TZDs, like pioglitazone, Actos. And finally, gastrointestinal drugs, proton pump inhibitors, also known as PPIs, like omeprazole, Prilosec, and H2 receptor antagonists, like cimetidine, Tagamet. Remember, breaking down drug classes helps you see the differences and similarities between drugs, making them easier to remember and apply in real-life scenarios. Third step. Take each drug subgroup and dig into its specific characteristics. Let's focus on 5 key characteristics for each drug class. Mechanism of action. How does the drug work at the cellular level? Therapeutic uses. What conditions is the drug used to treat? Side effects. What are the potential side effects of the drug? Contraindications. Are there any situations where the drug should not be used? Drug interactions. Does the drug interact with other medications or substances? Here are some examples. Starting with antidepressants. Selective serotonin reuptake inhibitors, SSRIs. Mechanism of action. Increase serotonin levels in the brain. Therapeutic uses. Depression, anxiety, obsessive-compulsive disorder, OCD. Side effects, nausea, headache, sexual dysfunction. Contraindications, hypersensitivity, recent myocardial infarction. Drug interactions, monoamine oxidase inhibitors, MAOIs, can cause serotonin syndrome, atypical antidepressants. Mechanism of action, vary by drug, but often involve increasing norepinephrine and/or dopamine levels. Therapeutic uses, depression, anxiety, bulimia nervosa. Side effects, increased appetite, insomnia, dry mouth. Contraindications, hypersensitivity, recent myocardial infarction for some drugs. Drug interactions, MAOIs, can cause serotonin syndrome. Next up, antipsychotics. Typical antipsychotics. Mechanism of action, block dopamine receptors in the brain. Therapeutic uses, schizophrenia, bipolar disorder, psychotic symptoms. Side effects, extrapyramidal symptoms, EPS, tardive dyskinesia, weight gain. Contraindications, hypersensitivity, narrow-angle glaucoma. Drug interactions, anticholinergic drugs can increase the risk of EPS, atypical antipsychotics. Mechanism of action, block dopamine and serotonin receptors. Therapeutic uses, schizophrenia, bipolar disorder, depression, anxiety. Side effects, weight gain, metabolic syndrome. Sedation. Contraindications, hypersensitivity, narrow-angle glaucoma. Drug interactions, anticholinergic drugs, sedatives. Lastly, anxiolytics, benzodiazepines. Mechanism of action, enhance the effects of GABA, a neurotransmitter that promotes relaxation. Therapeutic uses, anxiety, insomnia, muscle relaxation. Side effects, sedation, dizziness, impaired coordination. Contraindications, hypersensitivity, respiratory depression. Drug interactions, other CNS depressants. Non-benzodiazepine, hypnotics. Mechanism of action, promote sleep by targeting specific receptors in the brain. Therapeutic uses, insomnia. Side effects, somnambulism, complex sleep behaviors. Contraindications, hypersensitivity, severe respiratory depression. Drug interactions, other CNS depressants. Remember, a deep understanding of drug class characteristics is essential for success in pharmacology exams. By actively studying and analyzing this information, you'll be well prepared to demonstrate your knowledge and skills. Step 4. Comparing and contrasting similar drugs helps you understand how they stand out from each other. Here are some examples. First, we have antidepressants. We can divide it into two rows labeled as SSRIs and atypical antidepressants, and have four columns labeled as mechanisms of action, common side effects, weight gain, and sedation. For mechanisms of action, SSRIs primarily block serotonin reuptake, while atypical antidepressants work differently, often increasing norepinephrine or dopamine. For common side effects, SSRIs cause nausea, headache, sexual dysfunction, while atypical antidepressants cause increased appetite, insomnia, dry mouth. For weight gain, SSRIs are less likely to cause significant weight gain, while atypical antidepressants is more likely to cause weight gain. Lastly, sedation. SSRIs generally cause less sedating, while atypical antidepressants can be more sedating, especially at higher doses. It is better to note that some atypical antidepressants, like bupropion, help reduce sexual side effects common with SSRIs. Second, we have antipsychotics. We can divide it into two rows labeled as typical and atypical antipsychotics, and have three columns labeled as mechanisms of action, common side effects, and sedation. For mechanisms of action, typical antipsychotics primarily block dopamine receptors, while atypical antipsychotics block dopamine and serotonin receptors. For side effects, typical antipsychotics have a higher risk of extrapyramidal symptoms, EPS, tardive dyskinesia, while atypical antipsychotics have a lower risk of EPS, but higher risk of weight gain and metabolic side effects. Lastly, sedation. Typical antipsychotics generally are more sedating, while atypical antipsychotics can be sedating, but often less so than typical antipsychotics. It is better to note that atypical antipsychotics are often preferred due to their lower risk of EPS and broader range of therapeutic uses. Last but not the least, we have anxiolytics. We can divide it into two rows labeled as benzodiazepines and non-benzodiazepine hypnotics, and have four columns labeled as mechanisms of action, common uses, side effects, and dependence potential. For mechanisms of action, benzodiazepines enhance GABA activity, while non-benzodiazepine hypnotics target specific GABA receptors. For common uses, benzodiazepines may cause anxiety, insomnia, muscle relaxation, while non-benzodiazepine hypnotics only cause insomnia. For side effects, benzodiazepines cause sedation, dizziness, impaired coordination, while non-benzodiazepine hypnotics cause somnambulism, complex sleep behaviors. Lastly, dependence potential. Benzodiazepines have a higher risk of dependence, while non-benzodiazepine hypnotics only have lower risk of dependence. It is better to note that non-benzodiazepine hypnotics are often preferred for long-term use due to their lower risk of dependence. Remember, by comparing and contrasting these drug subgroups, you will gain a deeper understanding of their unique characteristics and be able to answer specific pharmacology exam questions. Lastly, Step 5. Practice active recall to reinforce all this knowledge. Use tools like acronyms to keep it simple. Here are few techniques to help you even more. Technique 1. Create acronyms for drug classes. Here are some examples. Antihypertensives, never. Nitrates, enalapril, verapamil, erythromycin. Antidepressants, SSRI, selective serotonin, reuptake inhibitors. Anxiolytics, BZD, benzodiazepines. Anti-diabetic agents, SSS, sulfonylureas, biguanides, thiazolidinediones. Technique 2. Make rhymes to remember actions. Beta blockers. Beta blockers block the beat, lower blood pressure, and make the heart retreat. ACE inhibitors. ACE inhibitors, a lifesaver, lower blood pressure, and prevent heart failure. SSRI antidepressants. SSRI, serotonin's friend, lifts depression, helps to the end. Technique 3. Use acrostics to remember lists. For antipsychotics, try atypical, atypical, typical, ziprasidone, quetiapine, aripiprazole, risperidone, olanzapine. For gastrointestinal, try PPIs. Proton pump inhibitors. For cardiovascular, try ABC, angiotensin-converting enzyme inhibitors, beta blockers, and calcium channel blockers. Technique 4. Make flashcards for quick quizzing. Write drug names, classes, and key information on one side, and the corresponding details on the other. Quiz yourself regularly. Lastly, Technique 5. Form study groups. Discuss and quiz each other with your classmates. Or use online resources. Many online platforms offer quizzes and practice exams to help you test your knowledge. This will help reinforce your memory and identify areas where you may need further study. Follow for more NP Made Easy by Latrina Walden, or check our page for more in-depth resources.